Hello, Miss Henry. Today, I'm Dr. Cornerstone. I will be talking to you about your rehab plan for your double hip replacement surgery. Okay, so starting next week, once you have mastered getting out of bed, I'm going to recommend sending you to a short-term rehabilitation facility. There you will attend physical therapy sessions twice a day for 2 weeks, and then you'll probably be able to return home and attend outpatient therapy sessions twice or 3 times a week. Notice when you're at home and you just go and see physical therapists and occupational therapists. Most likely, after 15 days or 2 weeks or so, you will see another doctor for your follow-up, and then any changes to your therapy will be assessed then, and your follow-up appointments will be at 3 weeks, 6 weeks, 3 months, 6 months, and 12 months unless you are experiencing severe pains. Possible goals for your rehab with your therapist. You're going to learn to move independently. You may use a walker or crutches at first. Then you're going to learn to transfer from a chair or toilet by yourself. You will also learn to walk in the hallway. You can use a walker or crutches at first. Then we're going to attempt stairs, and you may purchase compression stockings to increase blood flow. So, your physical therapy will be focusing on increasing your range of motion in your new joint, as well as strengthening the muscles around your hips. These could include quad sets, ankle pumps, hip abduction, hip and knee flexion, knee extension, squats, and standing hip flexion exercises. Balancing exercises will also be included. We may use ice or heat, and the ice will be used to cool down after and deswell sore muscles after working out, and your heat will be used to warm up your tight muscles before you start. Okay, so possible goals for your occupational therapy. We're going to help you adapt to your new hip and accommodate your old life with your new hip. So, like exercises would be turning in bed and getting up to a sitting position, getting out of bed to stand, and moving to a chair. You may use a walker or crutches at first. Then putting on your shoes and socks, walking and stair climbing, pushing, pulling, and possibly getting into a car. Like the physical therapy sessions, the muscles in your hip, knee, ankle, and quads are the most important muscles that you need to build up so you can prevent re-injuring yourself. Suggestions. You might want to stay at home with friends or family, and hopefully they can help with the cleaning and shopping because you don't want to do a bunch of heavy lifting right after this. You will not be able to drive 3 to 6 weeks or longer, so you might want to plan transportation. You can hire a home care agency that will help you with daily domestic chores. You may also want to stock up on foods that are easy to prepare, like canned or frozen foods. I recommend using a cane or crutches or walkers or handrails at first, and then a psychologist may help you deal with the psychological aspects of getting a new hip, the frustrations of relearning tasks, and the obstacles of hip immobility. Other suggestions are avoid heavy lifting. Like I said, sit in a firm straight back chair. To help avoid falls, remove all throwaways and keep the floor and rooms clutter free. You also might want a shower chair as well as an elevated toilet seat to prevent bending too far at the hips after you are no longer required to use a catheter. You also may want to use a long-handled reacher to turn on lights or to grab things that are beyond arm length. Also keep enthusiastic kids and pets away. These are some precautions that I have, put together. Stairs are difficult and hazardous and should be avoided. Do not cross your legs past your midline or turn your legs inward. Make sure when you turn, do not pivot. Do not bend at the waist past 90 degrees. This includes bending forward at the waist and squatting. If you do not follow these, this is just a disclaimer, just a safety precaution. If you do not follow these precautions, you could dislocate your hip and have to get another surgery, but that will not be a problem. And that is it for today. See you later, Ms. Henry.